Right now, across the country, nearly 10,000 people and their families know what it's like to have COVID-19. For some, it means crushing pain, and for their families, indescribable fear. Megan Kerwin and her husband Robin live in wealth. They're both 46 and in good health. But 2 weeks ago, Robin became one of the presumptive cases of COVID-19 in Canada, where he became very ill very quickly. Megan joins us now to share hers and Robin's experience. Good morning to you. Thank you so much for being here. When did you first realize something was wrong?
So his symptoms started on a Friday, and as they progressed, he started with a sore throat, and then it moved into a cough by the Saturday night, and then by the Sunday, the cough progressed, and then overnight on the Tuesday, he spiked a fever, and by the Wednesday morning, he was barely able to get out of bed. So that's when we knew something was really wrong.
Now, you live with your husband and your mom, who's 78. You also have a son who has asthma. So how did you navigate all of that while trying to keep your husband isolated?
Well, it really was when we were leaving, we went into the hospital we went to the hospital, not into the hospital. They did all the assessment outside of it, which was amazing. And as we were leaving there, and he was so out of his normals, it was not him. And I was driving, and I had this sudden fear that, oh my gosh, I think he could die from this. And in that moment, I made an actual choice not to go down the path of fear. And so when I arrived back to our place, we were up north, I looked at my mom and my son and explained the situation. And at that moment, we made the decision of how we were going to cope through this disease. And we cared for him. I mean, when someone's that sick, you can't actually be with them. But we actually cared for ourselves more through moments of joy and cooking and dancing and trying to find light in the darkness.
I cannot imagine being faced with that circumstance. Was there a turning point at all during all of this for you?
Well, I think the turning point, not to his wellness, but to the turning point of fear was walking in. I had self-isolated as he started the cough, and seeing him on the bed. I've been with him for 25 years, love the man more than anything, and seeing that he actually was unable to move and not being able to get up and help him out of bed, but have it, because we knew at that point we had an idea of what was happening. And that really was a turning point of, this is very serious. And then as he got better, it took a period of time. And that was also a period of really digging deep and trying to cope through those moments.
Megan, how is Robin doing now?
He is recovered. He's still in isolation 3 weeks later, and he's coming back to us soon. He's up north on his own. So we look forward to seeing him soon.
Megan, on behalf of everyone here, we're so sorry that you went through that. We're so happy that it seems to be coming to an end, that there is indeed a light at the end of that tunnel. We wish you and yours nothing but happiness and health. Thank you so much for joining us today.
Thank you, Ben.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.